Globally, dengue cases are on the rise, particularly in tropical regions. North and South American countries have recorded a record 9.7 million dengue cases in 2024. Spread primarily by the Aedes aegypti mosquito, also known to carry yellow fever, chikungunya, and Zika viruses. Officials say climate change is partly to blame for the dengue surge.
Well, we're definitely seeing climate change affecting where we're finding these mosquito vectors. We're seeing them popping up in areas that we've never seen them before. 10 years ago, California had never seen an Aedes aegypti, and now, it continues to spread, and that's just one area.
The U.S. has seen 3,280 reported dengue cases this year, including 2,209 in Puerto Rico, prompting a public health emergency declaration on the island territory.
So in the United States, things are changing. We have warmer weather. We have a lot of rainfall. Even if you think about it, with heavier rainfall, you have more moisture in the air. And so a lot of the mosquitoes' life is spent resting in habitats like dense vegetation and so forth. These are ideal conditions for the mosquito.
Florida leads in dengue cases in the continental U.S., with mosquito control units actively targeting the Aedes aegypti mosquito.
And we've done a lot over the last 10 or 15 years since we've seen dengue reemerge here in the Florida Keys. So we've got a number of inspectors that go house to house, business to business, educating people, letting them know where they can find these mosquitoes, treating any mosquitoes that they may find, and then all the way to our helicopters that are outfitted with a larvicide product that is a bacteria that's specific for mosquito larvae. Those larvae ingest that and it kills them.
Last month, local authorities issued a dengue fever alert here in the Florida Keys after confirming 3 cases of the mosquito-borne illness. Locally transmitted cases of dengue in Florida have raised concerns among authorities. About 1 in 4 dengue infections lead to illness, with 1 in 20 cases progressing to severe dengue, which can be life-threatening. Despite the high number of dengue cases, U.S. officials do not foresee a pandemic.
It's dangerous, but this is no time to panic. We have the situation under control.
The U.S. offers a dengue vaccine for children aged 9 to 16 living in endemic areas, but not for adults.
What works best to combat the mosquito proliferation?
Personal protection around your house. Like if you have standing water in containers, you can dump the water.
Some of the simplest interventions proving essential in combating this latest dengue outbreak. Nitza, Soledad, Perez, CGTN, Key Largo, Florida.